Welcome to the Connect Show. I'm Judy Sylvia, and I am delighted to be your host today. Thanks so much for joining us today and each week as we introduce you to wonderful people, businesses, organizations making a difference here in Southwest Florida. Today is no different. We have a wonderful show for you. On the second half of our show, we're going to visit with Pastors Dan and Nancy Turpin of West Coast Church in Englewood. We're going to hear about the incredible things God is doing in and through that mighty ministry, so look forward to that. And now our first guest, it's one of those hidden treasures that I love to help you discover. I am so excited for him to be on because he's going to help bring relief to those of you watching that are suffering with pain, whether it's a sports injury or arthritis. So let's welcome Dr. Ross Howard. Dr. Hauser, welcome to the Connect Show.
Thanks, Judy. Thanks for having me.
I so appreciate, first, I know what it's like in a doctor's life to take time out and to be able to come out and join us. And I know that there's so much to cover in a little time. So, Dr. Hauser, you have an office in Chicago and you recently opened one here.
Yeah, Judy, most people have never heard the term prolotherapist. I'm actually a prolotherapist. I work alongside of Dr. Special, who's also a prolotherapist. Those are doctors who specialize in regenerative medicine to regenerate the joints, the cartilage, the ligaments to relieve chronic pain.
So, okay, so remember, you're going to have to dumb it down for us here. Prolotherapy, what is that?
Prolotherapy is an injection technique that restarts the repair process. So most people with chronic pain, the pain is due to weakness or injury in structures such as the joints, ligaments, tendons. So prolotherapy is an injection technique that restarts the repair process. So the structures that cause the pain actually get repaired. Most chronic pain is that the body hasn't repaired an injury. Like we've all heard of like rotator cuff tears or labral tears or degenerative arthritis. What those injuries need is regeneration. The technique, the injection technique to regenerate a degenerated joint or to repair a tear without surgery, that technique is called prolotherapy. Prolotherapy. It stands for proliferate or proliferative therapy. We proliferate the cells that grow the ligaments, that grow the cartilage, that grows the tendons.
So, Dr. Hauser, what's in the injections that you do?
We use natural substances. So, Judy, let's just say you sprained your ankle. The cells release a sugar called dextrose. They release dextrose as well as fats, and those substances attract the immune system cells, and the immune system cells will try to repair your ankle sprain. So what prolotherapy does is use a natural sugar called dextrose, or we can get the cells out of your own body, like from your blood. We can draw some blood, we can centrifuge the blood down and get the platelets or the healing cells from your own body and inject those healing cells into your joint to regenerate the joint for like knee arthritis or back arthritis or neck pain to help repair the tissues and stop the pain.
Now, Dr. Hauser, there's a little video or animation that you brought. Maybe you can, Rick, can you play that and maybe you can tell us what we're seeing on the screen there?
Yeah, this is where the person or the animation is, we're injecting the ligaments. The ligaments are what connect the bones together. And then after the ligaments are healed, Judy, the body has normal motion. All of us have joints in our body that we have clicking, grinding, popping. That clicking, grinding, popping means the connectors or the ligaments are stretched out and loose. And when the joints move too much, that's what causes degenerative arthritis. So prolotherapy resolves the cause of degenerative arthritis, so somebody could get prolotherapy and not even need a surgery or a knee replacement or a joint replacement. So it's common for us to see people who have been told they need a surgery, but they want a natural option, such as prolotherapy.
And besides, what conditions do you treat besides arthritis?
The most common condition that we see is knee arthritis, but we see degenerative arthritis, sports injuries, and then we see anybody who has joint instability. Like, I'll give you an example, neck instability. You probably don't realize this, but when your neck vertebrae are moving too much, that can cause vertigo, tinnitus, migraine headaches. Almost everybody who has migraine headaches will tell you, Judy, that they either have neck pain before the migraine or during the migraine they'll get neck pain. So if you get neck pain during migraines, probably your neck is one of the causes of your migraine headaches. But any kind of sports injury, you know, tennis elbow, golfer's elbow, you know, rotator cuff tears.
This is amazing. I'm so excited. And now you're one of the few, if...
That's the first prolotherapy practice, full-time prolotherapy practice in Southwest Florida. You know, even before we were on the air, I told you God gave the body a tremendous ability to heal itself. But people stop the healing process by taking anti-inflammatories or corticosteroid shots. Prolotherapy restarts the repair process. So if you can't walk good before prolotherapy and you get prolotherapy on your knee or your hip, and then you can walk good, that means the degenerative arthritis has started to reverse, like it's strong.
That's great. Well, Dr. Hauser, we're going to take a quick break, okay? When we come back, we're going to have an opportunity to talk with Dr. Hauser's patient, Patty. Don't go away. Welcome back to the Connect Show. We're visiting with Dr. Hauser, now joined by his patient, Patty Dunning. Patty, welcome.
Thank you.
So, Patty, give us an idea of what you were struggling with that made you go see Dr. Hauser.
Well, my first visit was I took a friend of mine to see him do this because she was unable to drive. And as soon as I saw this, I knew that my neck needed that prolotherapy. And I started in February, and I've been going once a month, and believe you me, it's so much better. I don't have tinnitus, my earaches have quit, I can turn my head with no problem.
Dr. Hauser, do you want to tell us what you saw in Patty and treatment?
Well, she's just a good example of, like, often people, they've had problems for years. I mean, how long have you had that? You had that, like...
20 years or more.
You know what I mean? So again, prolotherapy restarts the healing cascade. So Patty had degenerative arthritis. She had some clicking, cracking in her neck, which was pinching on some nerves, which were causing the tinnitus, the ear pain. But she's also a good example of, like, having arthritis all over her body. And you had other areas done. Like, what other areas have you had?
Oh, yes. After the first time, and I realized how good it was doing, I said, well, I couldn't move my hands, and they were numb. And now then, I can move my fingers, my knees, I can walk better. You got to realize I'm 85 years old, and I'm still going strong. And I think it's because of Dr. Hauser.
Well, and you've always looked gorgeous, Patty.
Oh, thank you.
No, but I mean, like, I would say probably initially when I was seeing her, I mean, you could just see that, like, she was very, very sad. And at moments, she would even probably, you could tell, like, she was holding back tears or whatever. So, again, the body has tremendous regenerative capabilities. We've treated age of 4 to 99. So somebody who's 85, they don't want to get a surgery. She doesn't want to get corticosteroid shots. You don't want to be on anti-inflammatory, so a much better option is try to stimulate the repair, and the treatment to stimulate the repair is prolotherapy.
And so what is the recovery time?
Yeah, normally it takes about 4 visits of prolotherapy, so we normally see people every 4 to 6 weeks. Judy, when you sprain your ankle, the body heals it over 4 to 6 weeks. You fracture a bone, right? You have a cast on for 4 to 6 weeks. So to get the full healing effect from prolotherapy, it takes about 4 to 6 weeks. So figure about once a month. We generally see people for 3 to 6 visits. The average person is 4 visits. So it is a 4-month process, but generally over the 4-month process, you slowly, methodically get better, feel stronger, able to work more. When do you feel back to normal, like after the prolotherapy? You have some stiffness for how many days?
Well, I just had it yesterday.
Okay, so she's
and I have a little stiffness today, but by tomorrow it'll be gone.
Well, if people come in the same day they go to work, but some of the cases, I mean, they do come in on a Friday because it takes, if you get a big treatment like your whole spine, it might take a couple of days to recovery, but it really doesn't interfere with your life. And we see athletes in the middle of their training. So I'm a 5-time Ironman, so I've done the Ironman triathlon 5 times. So I'm very used to treating athletes even in the middle of training. And prolotherapy doesn't disrupt their training, and it gets them stronger and healed in a quicker amount of time to get back to their training full out.
And Dr. Hauser, what I'm hearing, I'm thinking of all the people that I know that suffer with some form of chronic pain, and I'm thinking, wow, this is the hidden treasure that they don't know about yet here in Southwest Florida. Now, does Medicare cover it or insurance?
Right now it's a non-covered procedure by Medicare, but you got to realize, Judy, most of the people we've seen, they've tried all the Medicare covered procedures. So I'd really encourage people to try to resolve their chronic pain, and I think the best treatment to resolve chronic pain is prolotherapy.
Okay, and I know that you are, I can just tell when I met you, God's put you here, this is your passion, this is where He has you, and you are splitting your time between Chicago and here.
Yeah, and you know, Dr. Special and I both have been doing prolotherapy for over 20 years, so it's not like, you know, we started 2 weeks ago. So,
right.
And then, you know, we have a Facebook page that you could go to Caring Medical's Facebook page or caringmedical.com, and you could look at all the different conditions we treat. You know, you obviously could email me, but the best thing we'd love to see people is come to the Fort Myers office and get an evaluation. And
okay,
it may seem like you have a hopeless case, but again, pain is due to tissue. Pain means tissue injury, that there's the tissue that's weakened or injured, and all you have to do is stimulate its repair. So a natural way to stimulate repair is prolotherapy.
It sounds like hope out there for a lot of our viewers. So, well, Dr. Hauser, thank you for taking time to come on the show, and thank you for the difference you're making in Southwest Florida. Patty, thank you so much for just being a testimony to successful treatment, and appreciate all that you do as well.